Government of India and Ministry of Health has come up with the guidelines pertaining to the home isolation for mild and asymptomatic individuals. Those individuals who are symptomatic should get hospitalized at the earliest. But those are asymptomatic individuals, they need not go to the hospital. They need not, get hospitalized. Visit the, they should visit the practitioner. They should visit the. So, as far as government policies are concerned, it has come up with revised guidelines pertaining to the home isolation for mild asymptomatic individuals. So initially, with the previous variants, the home isolation was advocated for 14 days, but the revised guidelines have recommended isolation period or quarantining period of only for 7 days. But that quarantine period can also be reduced to 5 days, depending upon the decisions taken at the district level and the institutional level. The quarantine period can be as short as 5 days, because with this pandemic, a lot of healthcare workers were affected, and majority of them are out of work. So it will be very difficult to take care of the routine activities in the hospital and all that. So that's why probably, and second thing is probably these infections are not associated with very severe illnesses. So probably the quarantine period has been reduced to 5 days, but it is up to the discretion of the institute how much it has to be. But at least 7 to 10 days of quarantining is very, very important. And then documentation and the reporting of the individuals affected by COVID-19 is very, very important. And then those individuals who are elderly and at high risk individuals with comorbidities should be reported to the medical officers. And then immunocompromised individuals, transplant recipients, cancer patients should be isolated at home rather than being isolated in the hospital. And then all the family members should also be isolated at the same time. And then patients should not, affected individuals should not be involved in the household work. They should stay in a well ventilated room with cross ventilation and windows. They should have use a triple layer N95 mask for prevention of spread of infection. Mask should be discarded every 72 hours. And the patient should take rest and drink a lot of fluids and maintain adequate hydration. And then we should, the affected individual should follow respiratory etiquettes all the time. Frequent hand washing with soap water at least for 40 seconds and is very, very important. Patient should not share personal belongings or items with the other individuals. And then we should not touch the surfaces, okay, especially the tabletops, the doorknobs, handles, and we should undertake measures to prevent the spread of infection to the individuals who are taking care of the affected ones. And the self-monitoring with the blood oxygen saturation pulse oximeter will be very useful. Okay, and then self-monitoring is the key. And then tele consultations are useful. Even the patient has a self-monitoring, they can follow this self-monitoring chart where temperature, heart rate, saturation, whether the patient is feeling better or worse, and whether the breathing is better or worse can be monitored on the day-to-day basis. As far as the instructions of the mask, wearing mask is concerned, the instructions are the same, but the mask should be discarded after using it, and it should be used only for a minimum period of 72 hours. When it is discarded, it should be cut into pieces and then it should be discarded. Otherwise, the chances are that, like, though it may be reused again and again, and we should perform hand hygiene before and after disposal of the mask, and hand hygiene with soap water, hand hygiene with the sterilizing agents, chlorhexidine gluconate is very, very important. And we should avoid contact with the body fluids like respiratory, oral secretions, including saliva, especially for the healthcare workers. And then biomedical waste disposable guidelines should also be followed. Syringes, needles, okay, and medicines used ones should be collected in a separate bag, and it should be labeled as biomedical waste, and it should be disposed separately. Okay, so when do we need to seek medical attention? Any patient with unresolved high-grade fever, more than 100-degree temperature for more than 3 days, they should report to the hospital. And then those individuals who have difficulty in breathing, saturation less than 92%, persistence of the chest pain, confusion, or easy fatigability of the individual, they should report to the hospital. This is the management at home protocol, where the patient needs to be separated from the other individuals from the family. They should maintain all the etiquettes and the guidelines that I have just emphasized. So the discharge policy is also like any individual who is asymptomatic for 3 days should be discharged. And what about the vaccination? Any individual who got COVID-19 can be vaccinated after 3 months. And the booster dose can be taken after 9 months of the last dose. So that is how the vaccination can also be scheduled accordingly. And this is how the chart which has to be followed up. Asymptomatic individual, 7-day isolation. Symptomatic individual should get hospitalized. Again, when the asymptomatic individual is isolated for 7 days, is he vaccinated or not? If he is fully vaccinated, he can join the duty after 7 days. But if he is not fully vaccinated, he should repeat RT-PCR. If RT-PCR is positive, he can be isolated for some more time and can repeat RT-PCR again after 3 days. But those individuals who have negative RT-PCR can join duty as far as possible. And then the isolation period may be reduced from 7 days to 5 days in case there is severe crunch of trained health services provider. And this is the data provided by, or guideline provided by, the Ministry of Health. With this, I would like to conclude. COVID-19 infection with Omicron variant, can't take it lightly. It can be lethal if precautions are not followed up. Social distancing will remain the cornerstone of the prevention strategy, and then vaccination will be very, very useful. Those vaccinated individuals will have less severe infections, and then the rest of the treatment strategy will remain the same. This variant is considered like a vaccine. Those individuals who have got Omicron variant, it is considered that like a booster dose or vaccination. So let us see, over a period of time we will be able to gather some data whether Omicron is proving lethal or it is working like a vaccine for the individuals who are got affected. But the treatment strategies will remain the same. Social norms should be followed, and a good hospital care by the healthcare workers is always important. With this, I would like to conclude and would be happy to respond to some of the questions.